Welcome, everyone. My name is Chris Korchard-Keeler, and I serve as Senior Marketing Strategist at InnovateMR. Innovate is an independently owned global sample firm which specializes in consumer and B2B sample with a strong focus on advancing the industry and shedding light on a variety of important topics such as data quality and participant experience. I want to thank you for joining us for today's webinar. Today's webinar is scheduled to run about 45 minutes with some time at the end for questions. Please feel free to type those questions into the interface at any time. All participants have been muted, and a recording of this webinar will be sent to all attendees in the next few days. To get us started, I'd like to first introduce our speakers. LRW's Chief Research Officer, Hilary DeCamp, has a vast amount of experience and education in market research, accumulated over 30 years in the industry, the last 20 of them at LRW. Hilary's distinguished expertise makes her a force within the company, consistently leading efforts to cultivate quality and innovation, not only within LRW, but the industry at large. Hilary specializes in market segmentation of people and jobs to be done, LRW's gig segmentation, developed in partnership with LRW's pragmatic brain science team. Many clients demonstrated the impact of Hilary's work on choosing her to architect segmentations in additional categories or to evolve their segmentations repeatedly as their markets have shifted over the years. Hilary's outstanding leadership and capabilities span across a number of industries. Additionally, she holds a Bachelor of Arts in Quantitative Psychology from UCLA and a Master's in Marketing Research from the University of Georgia. Welcome, Hilary.
Thank you. It's great to be here.
Lisa Wilding-Brown has been in the industry for nearly 20 years. Lisa's specialties include sampling and survey design, panel development and management, online and mobile recruitment, as well as full-service mixed-mode field management. As Chief Research Officer at InnovateMR, Lisa is responsible for panel quality, best practices, and sampling methodologies, as well as spearheading the firm's insights platform. Prior to joining Innovate, Lisa was a member of the executive team at USAMP, where she developed the company's global panel and led the firm's mobile business division. Lisa got her start in market research at Harris Interactive, where she played an instrumental role in developing the company's first full-service online project management group. Lisa later joined the panel team, focusing her efforts on research, survey methodology, specialty panel development, and online user engagement from the Harris Poll Online. Lisa serves on the board for both the MMRA and UTA's Master of Science in Marketing Research, and as an active contributor to WireExec, the Women in Research Mentorship Program, and the GRBN. Lisa has presented at conferences such as APOR, the MRMW North America and Europe, the MRS, the Insights Association, IIEX, SampleCon, and she has published research related to engagement, online survey design, online quality, and mobile best practices. So that brings us to the heart of today's discussion, exploring how the COVID-19 pandemic is shaping consumer trends in the US. We'll be sharing the insights from the third wave of our consumer pulse studies on the social and economic impact of the coronavirus. Lisa, can you get us started?
Sure can. Thanks so much, Chris. I am absolutely thrilled to be partnering today with Hilary to report our findings from our COVID research. When we first started sheltering in place as a country, I think many people in industries felt utterly stunned. I know I did. We've been hearing from many clients and partners that research budgets have been reduced, and just a few short weeks ago, SMR released a report that predicts a staggering spend reduction to the insights space. However, despite this concerning prediction, organizations like SMR and the Insights Association have been actively communicating the important role that research plays in helping brands navigate this exceptionally fluid situation. So to help with this effort, InnovateMR has been conducting a series of COVID-related studies, and we've been partnering with several clients to achieve these goals, including the LRW group. So let's get into the agenda on what we are going to cover today. We will be covering a wide variety of topics, including confidence around healthcare and medical screening, the personal and financial impacts Americans are experiencing, predictions around when life will get back to normal, as well as perspectives around social distancing, highlighting those who aren't cooperating, and get a deeper understanding on what the key drivers are that influence consumers' stance on relaxing their distancing efforts. We also wanted to understand how Americans will change their greeting style, the impact on activities in and out of the home, the news sources most used for information about the pandemic, perspectives on privacy, especially as it relates to mitigation tactics and contact tracing measures that several state governments are undertaking, as well as satisfaction on government response and the interactions consumers are having with brands. And from there, Hilary will be taking a deep dive on some fascinating segmentation analysis and help us understand the various cohort groups that exist among Americans. The LRW group's been working very closely with many brands and the appropriate messaging needed to serve these various profiles with really great success. We want to share that today. And then, of course, we'll wrap up with some key takeaways from our research. So let's get started. So real quick, I just want to run you through our study methodology. As Chris mentioned, we've conducted this study on 3 separate occasions. We've included the field dates here, the most recent one fielding May 6th through May 14th of this year. We had close to 2,000 US consumers in our most recent study. Length of interview time was about 21 minutes. We balanced the sample outgo according to census by age, gender, region, ethnicity, income, education, and employment status to really get a good representative sample in order to pull our insights from. We supplied the sample from our proprietary panel called Point Club, as well as conducted the programming services and analysis in partnership with the LRW group. And I want to say a special thank you to Hilary, who's been a really incredible collaborator through this process, and I'm excited to go through some data with her today. But I also want to give a special shout out to all the clients who've contributed questions over these last 3 studies, so thank you all for that. Okay, so let's jump right in. You know, we closed the economy so we could ramp up the healthcare system to face the pandemic. For people to feel comfortable venturing back out into the economy, they need to be confident in our healthcare system's capacity and ability to effectively screen and mitigate this dangerous virus. The good news is that confidence, while still not optimal, is up since we first started reporting. You can see here 42% have confidence in medical screening versus 37% in wave 2. 53% have confidence in the healthcare system versus 51% in wave 2. From a regional perspective, the Southeast continues to show the highest level of confidence, 46% in wave 3 versus 43% in wave 2. Interestingly, the East Central region has increased confidence significantly. Wave 2, we observed 28% versus 44% in wave 3. And as it relates to the healthcare system's ability to manage and combat the coronavirus, women are still showing lower confidence, 48% versus men at 58%. Although I should note that this variance that we're observing here is really closing in. We saw a much wider range between both men and women in previous waves, so that variance is closing between these 2 groups. Hispanics are showing an increase in confidence, 41% in wave 2 versus 48% in wave 3. However, they still represent the lowest confidence level among race. And interestingly, African Americans are consistently showing higher confidence at 53%, despite the disproportionate mortality rates that are widely documented among the population. So next, I'll hand it over to Hilary to discuss the impact on income and the corresponding expectations for the future. Hilary?
Thank you. You know, at the same time that confidence in healthcare is increasing, concerns are shifting to economic ones. Despite a rebounding stock market, unemployment figures are soaring, primarily impacting lower paid people in the hospitality and service sectors that can't work from home, widening the divide between the haves and the have-nots. In our study, half of respondents emerge as largely unscathed, indicating that they've not experienced a significant reduction in their income and do not expect to next year. As a result, they're less likely to have cut back on their spending or to anticipate long-term behavior change, causing them to be overrepresented among the maintainer segment of Kelton's behavior adaptation framework, which we'll be touching on much later. This group that skews older, higher income, and more Caucasian is going to be needed to fuel any real economic rebound. About 1 in 8 are optimistically classified as rebounders. They've had significant reductions or even cessation of their income, but they believe their financial situation will improve next year. This hopeful group tends to be younger, more urban, parents of color living in coastal areas that are opening more gradually. Only time will tell how things will actually work out for them. 1 in 12 are nervous about their financial situation. While their income has remained stable, this middle income group is closely following the news and has the longest time horizon for getting things back to normal. They're waiting for the other shoe to drop, and they're likely to carefully restrict their spending by avoiding non-essential purchases or trading down to less expensive brands. Just over a quarter are the real victims in the economic crisis spawned by this virus. This group that was already lower income has lost their jobs or had a steep cut in wages without any confidence that they can rebound next year. Victims skew younger and Hispanic with kids to feed, so they're quite anxious about the situation and changing their spending behavior across a lot of different categories. More on that later.
Thanks, Hilary. It's fascinating stuff. So moving on to our next slide. While we are focused on staying physically well and avoiding the virus, many Americans are experiencing greater levels of anxiety, and we're seeing a growing number of communications and outreach around mental health. Aside from the obvious isolation, income loss is directly correlated to feeling anxious. We see here that Americans who've experienced a negative impact on their income are twice as likely to be feeling anxious versus others who have not been impacted financially. Americans under 30 are feeling this effect the most, and they are the primary group has experienced the most loss as it relates to income. Regionality is also at play here, with hotspots like the Northeast feeling more anxious versus their counterparts in the Southeast. And from a political perspective, those on the left of the political spectrum are displaying higher levels of anxiety versus those on the right. Here's a look at some troubling changes in habits that I'm sure are connected to the increase in anxiety that we just covered. Nearly 30% of Americans are having trouble sleeping. Among this group, women are feeling the strain most, with 33% reporting difficulty catching Z's versus men at 23%. Additionally, Americans who report a mental illness are having issues sleeping at 43%, as well as those who suffer from a high level of anxiety at 45%. We also looked at this variable across work settings, and unsurprisingly, Americans working outside of the home indicate difficulty sleeping at 41% versus at-home workers, which came in at 28%. We see a consistent increase across waves in drinking alcohol, with 20% of Americans reporting that they are drinking more, and 17% of participants indicate that they've gained weight. Perhaps these two go hand in hand. Brands such as Jenny Craig and others who offer food delivery and dieting support could win out as they help consumers avoid the grocery store and help them to combat the quarantine-19. Since we started our research in March, we've been asking Americans to predict when life will get back to normal. And we can see here that pessimism is on the rise. When we asked participants in March, shortly after sheltering in place was initiated, 65% expected life to return to normal within 6 months. However, this has decreased to 51% in our latest wave, and the number of Americans expecting it to take longer than 6 months is on the rise from 22% in wave 1 to now 39% in wave 3. Though people aren't ready to fully resume past behaviors, quarantine fatigue is definitely setting in. Support for social distancing, while still high, is down from 9 in 10 in wave 1 of our research to 8 in 10 2 months later. This figure drops further among certain groups, such as Republicans. 77% of those folks on the right agree with social distancing as a mitigation tactic versus Democrats, who report nearly 90%. We also see a difference when we look at Americans who suffer from a high level of anxiety. 90% of that group reported support for social distancing, while participants who are experiencing a low level of anxiety reported 11 percentage points below this figure. We also wanted to understand who among those we surveyed had family members who were not exercising social distancing. Despite being in the Northeast myself, I have a few family members that aren't taking my state's policy very seriously, and I know I'm not alone. In our most recent wave, 1 in 5 Americans indicate that they have a family member who is not cooperating, with younger members of the family being the worst offenders at 42% versus older members who represent 10 points below this figure. The main reasons for non-compliance are different though for each segment. Younger people are more likely to be bored at home or having trouble with the isolation versus older Americans who believe they are safe due to their protective gear. And now I'll hand it back to Hilary to discuss what needs to happen before Americans stop social distancing. Hilary?
If your business depends on people interacting or congregating in public places, or your business model has adapted to facilitate safer at home cocooning behaviors, it's important to understand who is most likely to be distancing and what triggers will lead them to ease up on that, so you can plan around this. The country falls into two camps, largely along partisan political lines. Democrats over-index on waiting for a vaccine, effective preventive measures, antibody testing, or a recommendation from the medical establishment. In contrast, Republicans over-index on waiting for the restrictions to lift and the doors to open, which has already happened in many areas, or for the president to say it's okay to get back out there, which he already has. If you're running get back out there messaging, you're likely to get a higher return on your marketing dollars if you target the message to Republicans or use conservative-leaning media. Independents, not surprisingly, want to make up their own minds based on the cases and death counts. Since these figures are publicly available, sometimes as granular as the county level, you can predict that this third of the market will be more addressable in places where the numbers are declining.
Thanks, Hilary. You know, I was at the Corks Brooklyn conference in early March. In fact, this was the last conference I attended before the nation went into lockdown, and I had a few folks give me a friendly elbow bump instead of the typical handshake as news of this deadly virus really started to pick up steam that week. And at the time, it seemed super novel and usually followed with like an awkward giggle, but changing our greeting style is very much on the horizon. We asked if Americans intended to change their greeting style, and nearly 1 in 2 confirmed that they would indeed greet friends and family differently in the future. Of those who indicated an expected change, nearly 50% will opt for a simple verbal hello. Women are demonstrating a more conservative approach as it relates to the verbal hello, as 53% selected that option versus men at 43%. Interestingly, we saw that adults 50 plus are nearly 2 times more likely to opt for an elbow bump versus adults 18 to 29. Go figure. I was really surprised by that. The next chart addresses the impact on certain activities. We've ranked the chart by the blue segment here, which represents activities that may never go back to how it was before the pandemic hit. And you can see that events outside of the home are enduring the biggest impact here. 36% of Americans anticipate a permanent change to concert going and sporting events where large crowds gather. 34% of Americans are saying the same thing as it relates to going to the movies, followed by 32% of participants indicating a change in using rideshare services like Uber or Lyft. Conversely, getting takeout food will be a popular option in helping Americans avoid large gatherings, and you can also see Americans will focus on investments like the stock market. A focus on building up savings has been a consistent finding in our previous research, which really reflects the commitment people are making to better position themselves financially in the future. In our research, we asked what types of content people are engaging with most, and to no surprise, the news consistently ranks high. With so many options to choose from, Americans are seeking out local coverage as well as scientific resources the most, and this really reinforces the regionality of impact. People want news that is specific to them and to understand the exposure risk that is driven by locality. Additionally, we can see here that scientific resources and database evidence are relied upon greatly, and this is very central to Americans versus other news sources.
Privacy is a topic area that is very near and dear to me. Our company conducted a national study late last year covering this very topic that we later presented at the Insights Association's chapter conference in Vegas, along with our partners and friends at Research Narrative. So the team and I really wanted to include some additional questions in this study to understand how Americans are feeling about privacy in general, as well as through the lens of COVID-19. This is especially important as more states are moving to institute regulation and impose mitigation tactics that include things like contact tracing to help abate the spread of the virus. And one thing is for sure, privacy matters, and Americans are feeling more unsettled than they were just 6 months ago, with 60% reporting more concern on this issue. Next, we wanted to understand how Americans feel about sharing specific types of information. This chart shows the bottom 2 box results on comfort level as it relates to different data categories. Financial data at 58%, followed by location data, purchase data, and daily activity all came in at 49%, generating the highest level of discomfort. Surprisingly, we don't see significant differences among political affiliation, suggesting this sentiment is truly bipartisan in nature. It'd be really important for brands and government agencies alike to understand consumer sensitivities around privacy and to be transparent about the data that is collected, used, stored, and ultimately, when and if destroyed. Transparency will be key, and any efforts to implement contact tracing will likely be met with some resistance that could reduce the effectiveness of these programs.
While the communication from government agencies and businesses has been prolific, satisfaction continues to trend downward across the board, with global businesses and the federal government performing the lowest here. Again, we're seeing a focus on locality and data-rich sources like the CDC. However, with the decline that we're observing here, it's safe to say that Americans, plainly put, they're feeling fatigued, frustrated, and generally dissatisfied across all of these different channels. With that said, what can businesses do to stand out? What brands are performing well? And what brands are offending Americans? I'm going to pass it over to Hilary to help us review these trends, as well as explore the different cohort groups that surfaced during this really insightful segmentation research. Hilary?
Thank you. When we asked people to cite the one company or brand who most offended you or let you down during the pandemic, I'm so pleased to say that most consumers couldn't think of any. This is really good news in such unprecedented times when it could be so easy to make a misstep. And as previously noted, these are politically divided times, so many people took this opportunity to vent about either the government or the media's coverage of it and the pandemic, rather than calling out brands or businesses for bad behavior. Likely due to the media coverage of their actions, though, some lashed out at large businesses that took PPP loans. Others called out GM and 3M for not converting their factories sooner. Tyson's brand may have suffered real harm based on the meatpacking plant outbreaks. In a segmented market, you just can't win. Hobby Lobby was criticized for staying open, while other retailers were criticized for closing. Some companies were praised for enforcing masks and social distancing, while others were critiqued for not doing more to protect customers. The most often criticized brands were the retail giants Amazon and Walmart. They and others were blamed for letting consumers down with out of stocks and delivery delays, or accused of mistreating workers through endangering or underpaying them. While Amazon and Walmart engendered some ill will during this time, though, they also won many fans, getting the lion's share of mentions when asked what companies or brands are reacting in a way you really like or respect. The companies scoring points with customers during these challenging times are those addressing the foundation of Maslow's hierarchy of needs: food, shelter, and safety. The biggest winners were grocers and restaurants who kept us fed, delivery apps and entertainment services who helped us stay home, companies who pitched in to make PPE, tests, hand sanitizer, and auto insurance companies who volunteered rebates, proactively doing the right thing. From this question, you can really tell that many companies stepped up during this difficult time and consumers recognized their efforts. Most people were able to cite multiple brands or companies by name. In this visual, the word grocery reflects a net of numerous local and regional chains who were all praised by name. Nearly all categories that are not at the base of Maslow's hierarchy have suffered greatly during this time, even if they remain technically open or available. To better understand how consumers are adjusting their category behavior in response to the pandemic, LOW Group's Kelton Global developed a behavior adaptation groups framework for classifying consumers based on how extensively they have changed or expect to change their behaviors across a bunch of different categories. And the country's roughly equally divided on the degree to which they have adapted their behaviors and expect to make the new normal look like the old normal. The most common reaction pattern is displayed by adapters who've shifted many behaviors, but expect to return to normal in most regards. Another third, the maintainers, have tried to stick to business as usual as much as possible and expect to get back to normal quickly. But 30% of consumers are classified as disruptors, who are deep diving into news and information about the crisis, fearing that we're opening too soon, planning to hold back themselves, and expecting many permanent changes to their behavior. And Kelton has been tracking these groups in their own series of coronavirus studies. If you'd like more information about these groups or to attend a webinar on the subject, please visit keltonglobal.com. While the behavior adaptation groups help us understand which consumers are likely to behave more or less differently as the country reopens, I find it useful to get underneath the hood and inside the hearts and minds of Americans who understand how they're reacting holistically to the pandemic. At LRW, we used InnovateMR's data to identify 4 coronavirus coping cohorts: the extremely anxious, safety seekers, insulated altruists, and the unconvinced. As anxiety about the healthcare system has been softening and the country's been reopening, we've seen modest growth over the past month in the size of safety seekers and unconvinced, and a shrinking of the extremely anxious. But all 4 groups still represent substantial chunks of the market that represent different opportunities for marketers and require different approaches from your messaging. As we go through the next 4 slides, think about where your product category has its greatest near-term opportunity and what type of messaging or offers might be required to tap that opportunity in an authentic and empathetic way. A thankfully smaller group today than a month ago, the extremely anxious are deeply distressed emotionally and finding it difficult to distance themselves not only from others, but from coronavirus concerns, either in conversation or in slumber. This group has high anxiety about the economy and the future, in part due to being hard hit in the pocketbook that was already stretched thin before this crisis. As a consequence, this group is heavily overrepresented among Kelton's disruptors and has the longest time horizon for returning to normal. As if lost jobs and reduced incomes were not enough to worry about, this group is also very concerned about the health of friends, family, and themselves. Only half think they'll remain well, likely since many are not able to socially distance and most have a comorbidity that puts them at risk of more severe outcomes. Add to this risk profile the compounding factors that they're less likely to be insured and to have confidence in the healthcare system and available screenings. It likely won't surprise you that the extremely anxious skew younger, female, urban, Hispanic, and Democrat, based on what we've told you so far today. This segment is the target for offerings such as cleaning supplies, debt relief, credit consolidation services, discount e-tailers, coupon apps, as well as skills training and affordable PPE. They are best addressed with messaging that is reassuring or supportive and avoids scare tactics. Moving on to the safety seekers. This growing segment takes COVID-19 very seriously and are being cautious with their money, but they're not overwhelmed by fear of the virus or the financial fallout of the shutdown. They are anxious about the health of friends and family, but confident in the healthcare system's ability to handle this, so long as others join them in fighting the good fight through social distancing. Half of them fear we're opening too soon. Safety seekers immerse themselves in coronavirus news coverage, left-leaning of course, and only 1% think the country is overreacting. Safety seekers skew to Kelton's adapters group and are likely to resume many activities when they are convinced it is safe to do so. As they are proactively taking steps to protect themselves, safety seekers are an excellent target for health and wellness categories such as home exercise equipment, immunity boosters, cleaning products, and fashionable facial coverings. If you want to appeal to safety seekers, emphasize the steps you're taking to ensure their safety and that of the public, and deliver your message through mainstream news media. Insulated altruists respect but don't fear the virus or its economic consequences. The vast majority of them expect they personally will remain well and are confident the healthcare system can take care of them if they don't. Although they skew somewhat older, they under-index on comorbidity risk factors, so few are afraid when they leave the house. They entered this crisis with higher incomes, have largely been unaffected by job losses or pay cuts, and anticipate this good fortune to continue. As a consequence, they skew towards Kelton's maintainers and indicate that they're helping others rather than just scraping by. Likely to be working from home, insulated altruists are a good target for home enhancement products or projects, financial planning services, fundraising pitches. Quality restaurants with clear safety steps will appeal to this adventurous group with money to burn. You can build affinity with this group through social responsibility messaging about what you're doing to help essential workers or to support the needy, but they don't need to hear what you're doing for them. And finally, the unconvinced, a small but growing segment. They are largely ignoring the crisis, avoiding coronavirus news, and criticizing what they hear. Pretty much they're over it. They expect that they and their loved ones will remain well. They think the country's overreacting. They don't think social distancing is important. So they really do think we've been closed for too long. They're feeling trapped or unduly restricted and would resist any attempt to rely on surveillance technology to fight the virus. They skew heavily towards Kelton's maintainers, and nearly half expect to be back to normal within 4 months, with the main barrier being the restrictions and the closures that are preventing them from doing so. They'll jump at the chance to visit bars and restaurants, travel for leisure, attend movies or events. They'll resonate with messaging that is outgoing, individualistic, fun-loving, perhaps even a touch rebellious. This group skews Republican and male in less populated geographies, precisely those on the bleeding edge of reopening.
All right, thank you so much, Hilary. It's so interesting to look at the different cohort groups, and I know friends and family that fall into each and every one of those groups. So it's really interesting, and you know, puts a lot of color around it when you categorize it that way, and helps to really help us to see through it and visualize it. Really comes to life. All right, well, I'm going to wrap up, and I know we've got a few questions coming in that Chris is queuing up for us. But the next couple of slides here are just some key takeaways from the research. Americans are still really feeling unsettled as it relates to medical screening healthcare, suggesting that agencies need to have a more really strategic plan bolstered by proactive communication to help assuage concerns. Brands should be mindful of the significant mental health and financial strain felt by Americans and really create solutions and services to meet these challenges. There are really several drivers to how Americans align to social distancing, as we saw here, but relaxing this effort is largely predicated on partisan politics. Satisfaction among all government and business channels continues to decline, with the federal government and global businesses performing the lowest. And so we should think about how loyalty among Americans can be maintained. People react best to companies successfully addressing the needs of consumers who are trying to stay home and navigate virtual service and delivery offerings. The negative reaction of consumers is largely divided across political lines, as Hilary mentioned, but critics do point to delivery delays, out-of-stock items, and failing to protect vulnerable workers as the main drivers of frustrations. So brands should really work diligently to resolve these issues and communicate the solutions implemented. While we feel the effects of the virus as a country, our reactions and outlook vary greatly. Segmentation analysis, as we saw here, is needed for brands to fully understand the various population cohorts and the unique drivers that dictate their decision-making. Out-of-home activities will be impacted for the long term. Companies in this space should try to find ways to pivot to virtual options that mitigate risk and recoup share of wallet. Americans are engaging with news with a marked focus on local media and scientific sources, suggesting that regionality has significant influence, along with a reliance on data to help inform social distancing efforts. Brands should look to understand regional variances and customize messaging accordingly, with a focus on data and empathy to win over customers. People are concerned about their privacy, which could make contact tracing and containment challenging. Brands and government agencies should reinforce their commitment to privacy and demonstrate transparent communication in their outreach efforts. And that wraps up our research. Hilary, thank you so much for all the wonderful collaboration. Chris, do we have any questions from the audience?
Yes, thanks, Lisa and Hilary. So the first question we received is, what is the main factor driving whether people social distance or not? Hilary, did you want to speak to that?
Sure. The decision to social distance, for those with the luxury of being able to, is heavily determined by a combination of perceived risk to yourself and to others, and the relative value placed on satisfying your own desires versus serving the greater good. The public narrative is pretty bifurcated on the subject of population risk, and the degree of personal risk is very stratified by geography and personal circumstances. So the perceived value of social distancing varies greatly from person to person. Unlike most of Asia, where the virus was successfully quelled, the US is a very individualistic society that tends to put the will and wants of the individual over those of the community. So many people are simply not wired to make the personal sacrifices associated with prolonged social distancing, especially if you tell them to. They need to view it as a decision they make for themselves.
Thank you, Hilary. So the next question we have, this isn't related to the survey per se, but what methods did you employ to mitigate potential quality issues that exist when surveying online sample?
That's a great
Lisa,
question.
did you want to speak to that?
Yeah, I'd love to. It's right up my alley. We take quality very seriously at Innovate. Cyber fraud is on the rise. There are various quality issues facing our industry, from sophisticated fraudsters who perform malicious activity at scale, to overzealous respondents who skew data with hyper satisfaction, hyper awareness, and over endorsement in general. And then on the other end, you've got natural duplication that can exist when a researcher procures sample from multiple sources. So it's really important to employ a multitude of tactics to mitigate these different use cases. And we have over 50 in place to thwart this bad behavior. We've got digital fingerprinting, geo IP checks, hidden reCAPTCHA, mobile and physical address verification, as well as multi-factor authentication. So all of those are at play here for this study and for our entire panel environment. I should note though too, like technological checks are important, but we also really value red herring design to test respondent authenticity and attention. So we have an extensive library of randomly presented red herrings in our panel environment. And for me, quality really exists on the respondent level. So it's important to be unpredictable and to change your tactics each time a panelist participates. So, bad actors out there really try to study your tactics. So you have to change that blueprint for success and remain as unpredictable as they are. So we had, all of these different checks in place and have really great quality as a result. And we actually just released a new tool called the Text Analyzer last year, which helps assess the quality of open-end responses in real time. And it's been a really effective tool in identifying participants who, provide less than desirable responses and may not really have their heart in the right place. So the tool itself looks for things like gibberish and duplication, copy pasting, speeding, even unwanted PII, and it checks for context to make sure that the response is contextual to the question presented. So long-winded answer, sorry. Short answer is yes, we have lots of layers to mitigate the risk. Chris?
Great, thanks so much, Lisa. So the next question we received is, what's your perspective on the current marketing landscape? Hilary, did you want to speak to that?
Sure. Even in relatively stable times, all marketers are segmented. People engage in a category for different ways, for different reasons. So it shouldn't surprise us that how people are responding to coronavirus is also segmented. The real question marketers need to be asking themselves is how their previous consumer segmentations and target segments are interacting with the massive disruption that's occurred. How are the various ways of adapting and reacting to the pandemic and its economic fallout likely to change the calculus about which segments offer the most opportunity or whether new priority segments may be emerging? Until they figure that out, my advice is to lean on heavily programmatic advertising and addressable media to allow super targeted messaging to the part of the market that is more fragmented than ever, so that the tonality can be appropriate to the target audience of interest, as people are reacting to the marketplace very differently right now.
Thank you, Hilary. And thank you also, Lisa, for your presentation. And thank you to our audience for attending. For any questions we weren't able to get to in the session, we'll be reaching out via email in the coming days. A recording of the webinar will also be sent out to all participants. So thank you everyone for joining us.